So most patients who present with hip pain are either diagnosed with femoroacetabular impingement, FAI, or hip dysplasia, or a labral tear. But however, there's an entity that is sometimes overlooked, which are the rotational deformities that could happen around the hip. These rotational deformities can happen on the acetabular side, or they can happen on the femoral side. Normally, the acetabulum should be facing forwards around 10 to 25 degrees. This is called acetabular anteversion. So the normal acetabular anteversion is from 10 to 25 degrees. Now, if that version is lower than 10 degrees, we call it acetabular retroversion. So what happens in acetabular retroversion? In the acetabular retroversion, the front of the femoral head bumps or impinges with the front of the acetabulum. And this causes pain at the front of the hip with activities such as walking or with sports, and sometimes also causes a labral tear. Excessive acetabular anteversion is the opposite. So instead of the acetabulum facing forwards 10 to 25 degrees, it's facing forwards more than 25 degrees. This also causes pain in the hip, either at the front of the hip because the hip is unstable, so the hip wants to move forwards, and the muscles and tissues prevent it from moving forwards, so this causes anterior hip pain, or because the back of the femoral head collides or impinges with the posterior rim of the acetabulum. This again also causes a labral tear. So how do we diagnose these problems? Well, they usually present in a very similar manner to femoroacetabular impingement, but there are certain findings on the radiographs that might give us a hint about the presence of these deformities. When we are suspicious about acetabular anteversion or retroversion, we then get a CT scan, which could accurately measure the amount of anteversion we have in the acetabulum. So how do we treat these problems? Well, initially, like with any hip problem, we give a trial of conservative treatment. This involves physiotherapy and activity modifications and lifestyle modifications. If this is unsuccessful, then we opt in for surgery. Now, there are two options for surgery: keyhole surgery or hip arthroscopy. The role of hip arthroscopy, though, is quite limited with rotational deformities. The hip arthroscopy could fix a torn labrum. It could remove a small rim of bone from the femoral head or from the rim of the socket of the acetabulum, and thus give some space for movement of the femoral head within the socket. But this role is quite limited, and surgeons who usually opt in for hip arthroscopy for rotational deformities around the hip are usually very cautious about their choice of patients. The third option is an osteotomy, which involves having to break the socket and reorient it, whether looking forwards or backwards, to counteract the deformity that's present. Thank you.